The examiner has washed his hands, introduced himself, and explained the procedure to the patient and gained his consent. Begin the examination by inspecting the auricle and the surrounding tissue for any deformity or lumps or lesions. Press firmly on the trachea and the mastoid bone. Tenderness here may suggest mastoiditis. Examine the ear canal and the eardrum using an otoscope. An otoscope is a tool which shines a beam of light to help visualize and examine the condition of the external auditory meatus and the tympanic membrane. Choose the largest possible speculum for the patient in order to maximize the light passing in the ear. Hold the otoscope like a pen, balancing between your index finger and your thumb. Extend your little finger and place it on the patient's face. This will ensure that you do not stab the patient's ear canal with the otoscope. To straighten the canal, move the ear upward, backward, and slightly away from the body. Check for any discharge, foreign bodies, redness, or swelling. Gently proceed down the canal until the tympanic membrane is seen. Examine the tympanic membrane and identify all the landmarks. One should be able to identify the handle of the malleus and the cone of light in the anterior inferior quadrant and the pars tensa, and we should be able to identify pars flaccida in the superior portions. Ear infections are a common problem, especially with small children. A dull or absent light reflex from the eardrum may be a sign of middle ear infection or fluid. The eardrum may be red and bulging if there is an infection. Amber liquid or bubbles behind the eardrum are often seen if fluid collects in the middle ear. Gently remove the otoscope, continuing to observe the ear canal for any pathologies that you may have missed on the way in. And then repeat the examination on the other ear.